I'm a local resident here in South Delta, and I'm one of many families who are gathering here today to express our concerns with proposed cutbacks at the South Delta Public Health Unit. For many of us, the South Delta Health Unit was our lifeline into the community, our lifeline to get support, and they provide great services, obviously not just for new mothers, we understand for seniors and other constituencies as well. But on a personal basis for this group today, we understand that the Public Health Unit provides many services to the community, from communicable diseases, prevention, communication, breastfeeding support, new mom support. But the problem, the difficulty, I guess, with public health in general, it's the intangibles that are so hard to measure. It's the people who are at risk of isolation in the society that can so easily get left behind, such as new mothers who are at risk for postpartum depression or just struggling generally, or seniors who might also be left isolated. And those are harder to measure, they're harder to track, and these are not people who can very simply reach out and have the capacity to understand that they need to get help. So we understand that the Public Health Unit provides many services. Obviously, with recent outbreaks that we've seen in the Lower Mainland, they are in charge of managing and communicating the risks there. Obviously, immunisation clinics and mom and baby groups and many other measurable services. But it's the intangibles that are so hard to measure. If you think of an at-risk mother who is vulnerable to postpartum, who does not have the capacity to reach out for help, it's having them here in our community that when they see a mom just go by and it's the quick "how are you" as they pass through the Public Health Unit. These are not the scheduled meetings, but these are the ones that uncover the people who truly need the help in our society. The Public Health Unit has a huge role to play in preventative health. Obviously, diseases and all our immunisations, as we said, but the mental health impacts. And if there is a loss to these services, the impacts to those will not be seen immediately. They're going to be seen and put a stress on other parts of our health services and other services in the community later. And we're anxious, we don't know what is going to happen to our community. So we reached out to Fraser Health to try and understand more. We have questions and we're not finding our answers too easily. So we're asking Dr. Nigel Murray, CEO Fraser Health, to live up to his commitment that they have on their own Fraser Health website, to give us his personal commitment to transparency on how they are going to deliver services in our community.